Every day in Australia, there are a significant number of people who are admitted to an acute hospital because they've had a fracture. And whilst we're very good at managing their fracture, we're not so good at actually identifying that this is a flag that they may have an underlying chronic disease, which is osteoporosis. So for these people, having a fracture is a major episode in their life. Many of these people don't return to their prior level of independent functioning. Many people do not return to being able to live in their own residence again. And there's an increased mortality at 5 years for any minimal trauma fracture.
So I just need to establish that you've fractured your left wrist.
Yes.
And how did you do that?
I was at my daughter's wedding and I fell.
Okay. You tripped or you actually...
I tripped. Yes.
Okay. Yeah, so it's just a simple
and
fall.
Landed on my
wrist.
My arm.
Okay. So a mechanical fall, we call that.
In our model of care, it was looking at identifying these people who have had a minimal trauma fracture, which is a fracture that results from just a slip, trip or fall from a standing height or less, as that's one of the first symptoms that occur for someone who may have a problem with osteoporosis.
So how much physical activity you do?
I don't do any.
Okay. Is there a reason for that?
I think it's boring.
Okay. Have you ever had a bone density study?
No, I haven't.
Okay. That's okay. How much time do you spend outside in the sun?
I don't go in the sun. I've got red hair. I burn very quickly,
Okay.
so
Yeah.
I just stay right out of the sun.
And now we'll take some blood from you. We'll do
Sure.
some blood tests.
After the patient has left hospital and gone home, then their osteoporosis risk screen that was done is then passed through to a multidisciplinary case review session. We have specialist medical staff and nursing staff that come together to review that person's risk screen, to look at the pathology tests that may have been done when the patient was in hospital, what additional tests would be indicated, and to write quite a detailed summary of that person's risk and their recommendations for management back to the patient's GP. The GP does get the latest evidence-based management so that the GP is then armed to work with the patient on a one-to-one level to decide ongoing management of osteoporosis.
Seems to be.
At the hospital you did have some tests, and this has been a useful feedback the hospital's provided for me. Whilst you're there they measured your vitamin D levels,
Right.
and they were surprisingly low.
Oh, okay.
And perhaps your habit of not being in sunlight's contributed to you having low vitamin D levels.
Right.
And low vitamin D levels means that you'll lose more of your bone strength. I think it's important we think about boosting your vitamin D levels.
Okay.
And we've got an option of giving you a catch-up dose
Okay.
for the first weeks, or just starting in on a replacement dose. Vitamin D also somehow helps people have less falls. Seems to help the muscles and coordination and things work a bit better.
That'd be helpful.
And how do you feel now about the prospect of taking a tablet for many years to help protect your bone strength?
I don't want it to happen again, so
Yeah.
I'm prepared to do whatever it takes to stop this from happening again.
Okay.
So can I make my bones stronger? Or
You
just
may-
stop them from getting weaker?
It's mostly about stopping them getting weaker.
Okay.
And we can't guarantee you'll never have any more fragility fractures. But the good news is that using these kinds of medicines, we can have a big impact on the risk of you having another fracture. It's in the order of 30 to 50%. But it will involve long-term medication use and long-term changes to some lifestyle factors.
Okay.
The diet, the exercise, perhaps checking if there's any particular risks of tripping and falling around your home.
Right.
Maybe looking at the types of shoes you wear will be important. Getting you into an exercise activity that involves retraining and maintaining your balance skills. All of these things will be important.
Okay, that sounds great.
When we developed the model of care, we were very aware of trying to keep that as a low cost intervention, and we went for as low as you could go and still hopefully be effective. So the model of care cost less than $16,000 per year to run, and that was for a small increase in nursing hours of 6 hours a week and the once a month medical specialists who came to do the case review session. We evaluated our model of care and we found that we had statistically significant increases in the number of people who were informed of osteoporosis and their risk of fractures, increased numbers who were on effective medications, and increased numbers who received other interventions such as falls prevention interventions. So for $150 per patient, it appears that this model of care can be very effective.